Mental health is something we all navigate every single day, and it really does shape, well, everything. How we feel, how we function.
Absolutely. It's much more than just, not having a mental illness. It's a resource, really, for individuals and for society.
And for this deep dive, we're looking at what the World Health Organization, the WHO, has to say. We're using their info from June 2022.
Right. The goal is to really get a handle on their perspective, what shapes mental health, what's happening globally to support it.
Yeah, what are the kind of key ideas we should take away?
And the WHO material is pretty comprehensive. It covers the basics, the definitions, right up to global strategies.
We'll touch on definitions, the factors involved.
Determinants, yeah. Promotion, prevention, care, treatment, the whole picture.
Yeah.
And the WHO's own global response.
Yeah, okay. So maybe you've wondered, what really influences your own mental well-being or what these big global efforts look like. Let's get into it.
Sounds good.
First things first, how does the WHO actually define mental health? What's their take?
Well, they define it as a state of mental well-being. That's key. It allows people to cope with life's stresses, realize their potential, learn well, work well, and importantly, contribute to their community.
So it's a positive state, not just the absence of a negative, more about capability and contribution.
Exactly. It's about functioning well, thriving, not just surviving. And it's definitely not static.
Right, you mentioned it's not like a switch on or off. It's more of a spectrum.
Precisely, a continuum. We all move along this continuum, experiencing, different levels of well-being, maybe some distress sometimes.
Okay, and that leads to an important point the WHO makes, doesn't it? The difference between general mental health and specific conditions.
Yes, a crucial distinction. Mental health conditions that includes things like diagnosed mental disorders, psychosocial disabilities.
Other states where someone's experiencing like significant distress or having trouble functioning.
Exactly that. But here's the nuance. Having a condition doesn't automatically mean low mental well-being all the time.
Ah, right. Someone can be managing a condition, but still have periods where they feel pretty good mentally.
Yes, absolutely. It's more likely they might struggle with well-being, but it's not a guarantee. It challenges that simple link people often make.
That's a really important clarification. Okay, so let's dig into the influences then. What shapes this state of mental well-being? Sounds complex.
It really is. The WHO frames it as this intricate interplay. You've got individual factors, social factors, structural ones, all interacting throughout life.
Some making us more vulnerable, some protecting us.
Exactly. Buffers and risks, essentially.
Okay, let's break those down. What about individual factors? What falls under that category?
So on the individual level, things like our emotional skills, how we handle failings,
Yeah.
substance use is a big one, obviously.
Mm-hmm.
And then there are biological aspects like our genetics, which can play a role in susceptibility.
Got it. So more internal stuff, but then there's the outside world, the social and structural factors. What does the WHO include there?
This is where the environment really comes in. Things like poverty, exposure to violence, discrimination, inequality.
Huge societal issues.
Huge. And environmental factors, too, like living in deprived areas. These things significantly increase the risk for mental health problems.
It just highlights how connected mental health is to, well, fairness and opportunity in society.
Absolutely. It's not just in our heads.
And the WHO points out that when these risks occur, matters a lot, right?
Yeah.
Especially early childhood.
Yes, very much so. Those early years are such sensitive developmental periods. Experiencing things like harsh parenting or physical punishment then.
Can have really damaging long-term effects.
Definitely. And they specifically mention bullying as a major risk factor for kids and adolescents. The impact of early adversity can significantly raise the odds of problems later in life.
Wow. That really drives home the importance of safe, nurturing environments for kids. But it's not all doom and gloom, is it? There are protective factors, too.
Right, exactly. Just as there are risks, there are things that build resilience. Good social and emotional skills help.
Positive relationships, support networks, getting a quality education, having decent work.
Things that give life stability and meaning.
Pretty much. Safe neighborhoods, community cohesion, that sense of belonging. These all strengthen our mental well-being.
So those are the kinds of things we should be trying to build up.
Ideally, yes, both personally and at a community level. And these factors operate at different scales.
What do you mean by scales?
Well, you have risks that are very local, affecting an individual, a family, maybe a neighborhood. But then you have huge global level stressors.
Like economic crises. or pandemics.
Exactly. Disease outbreaks, humanitarian emergencies, people being forcibly displaced, the climate crisis. These impact mental health on a massive scale.
It feels like a lot of interconnected webs, and the WHO is clear that you can't just point to one single factor and say that's the cause, right?
That's a really vital point.
Yeah.
No single risk or protective factor tells the whole story. It's almost always the result of these determinants interacting in complex ways. So someone might face risks, but have strong protective factors that help.
Precisely. Or vice versa. It's not a simple equation.
Okay, that gives us a good picture of the what and why. What about the how? How does the WHO suggest we actually promote good mental health and prevent problems?
Their approach is very much focused on tackling those determinants we just discussed. Identify the risks, reduce them, build resilience, create supportive environments.
Makes sense. Go upstream.
Exactly. And these actions, these interventions, can be aimed at individuals or specific groups who might be more vulnerable, or even whole populations.
And it sounds like this isn't just a job for doctors and therapists.
Definitely not. The WHO really pushes for multi-sectoral collaboration. Health is key, but so are education, labor, justice, transport, housing, welfare.
All these different areas impact our daily lives and opportunities.
Right. The health sector needs to help integrate mental health thinking into these other areas and, advocate for that collaboration.
Can you give an example? Like suicide prevention, it's a huge global priority. What works there, according to the WHO?
Several things. Limiting access to lethal means is critical. How the media reports on suicide matters, responsible reporting helps prevent contagion effects.
Okay.
For young people, social and emotional learning programs are really effective. And early intervention, identifying and helping people at risk. And they also mentioned something quite specific. Banning highly hazardous pesticides has actually been shown to be a very cost-effective way to reduce suicides in certain parts of the world.
Wow, that's fascinating. A public health measure having a direct mental health impact.
It shows that cross-sector thinking.
What about specifically for kids and teenagers promoting their mental health?
That's another big focus. Supportive policies and laws are important, helping caregivers provide nurturing environments. School-based programs, again, are key.
Like those social emotional learning ones.
Yes, the WHO highlights those as being particularly effective even in lower-income settings, and also working on making community and online spaces safer and more supportive for young people.
That seems crucial in today's world. And what about the workplace? So many of us spend so much time there.
Yeah, it's getting more attention, thankfully. The WHO suggests things like supportive laws around workplace mental health, organizations having actual strategies.
Not just paying lip service.
Right. Training managers to recognize and support staff, and providing interventions for workers who might need them.
Okay, so that covers promotion and prevention. But what about people who are already dealing with mental health conditions? What's the approach for care and treatment?
The WHO is very clear. Care and treatment are just as vital as prevention. You need both. And their big emphasis is on community-based mental health care.
Community-based rather than, say, large institutions. Why the focus there?
Several reasons. It's generally easier for people to access care in their community. It's often more acceptable to them.
Less stigma, perhaps?
Potentially, yes. It also helps prevent human rights violations, which have sadly been an issue in some large institutions in the past. And crucially, it seems to lead to better recovery outcomes.
Okay, so what does that community-based care actually look like? What kind of services are involved?
It's meant to be a network, so integrating mental health into general health care, like in your primary care clinic or local hospital.
So your regular doctor might play a role.
Exactly, maybe through task sharing, where they get trained to provide basic support or make referrals. Then you have dedicated community mental health centers or teams, plus things like psychosocial rehabilitation, peer support groups, people with lived experience helping others, and supported housing options.
And even outside health settings?
Yes, providing support through schools, child protection services, maybe even prisons. It's about meeting people where they are, like that task sharing example, a GP screening for depression during a regular checkup.
It sounds much more holistic and less isolated.
Mm-hmm.
But you mentioned earlier there's often a big gap between who needs care and who gets it.
Yes, the care gap. It's a massive global challenge, especially for common conditions like depression and anxiety. Many, many people don't get the support they need.
So what's the solution to that? How do we bridge the gap?
The WHO stresses innovation. We need to scale things up. This could involve training more non-specialist health workers to deliver basic psychological therapies.
Using the workforce we have more effectively.
Right. And leveraging technology, digital mental health tools, self-help apps, and resources, things that can reach more people.
That makes a lot of sense. Okay, stepping back to the big picture. What is the WHO itself doing on a global scale? What's their strategy?
They have a comprehensive mental health action plan running from 2013 to 2030. All the member countries have signed up to it.
And what are the main goals of that plan?
Broadly, four things: strengthen leadership and governance for mental health, develop comprehensive community-based care systems, implement promotion and prevention strategies, and improve information systems and research.
And how's the world doing on meeting those goals?
Well, the WHO's own mental health atlas from 2020 suggested that progress has been, well, insufficient, too slow. Not great news.
No, which is why they released the big World Mental Health Report, Transforming Mental Health for All. It was basically a major wake-up call.
A call to accelerate things. What does that report recommend?
Exactly. It calls for much faster implementation of the action plan, and it outlines three main paths to transformation.
Okay, what's the first path?
First, deepen the value given to mental health. This means individuals, communities, governments truly recognizing its importance and backing that up with commitment, engagement, and crucially, investment across all sectors.
So making it a real priority, not an afterthought. What's the second path?
Second, reshape environments. Our homes, schools, workplaces, communities, actively changing them to better protect mental health and prevent conditions from developing in the first place.
More proactive systemic changes. And the third path? Third is strengthening mental health care itself, making sure there's a full spectrum of services available, that they're accessible, affordable, good quality, and rooted in the community.
Value, environment, care. A pretty clear framework.
Yeah, it covers the key areas, and underpinning all of the WHO's work are some core principles.
Such as?
A strong focus on human rights is fundamental. Empowering people with lived experience, making sure their voices shape policies and services. And that multi-sectoral approach we talked about, getting everyone involved.
It's a shared responsibility.
Absolutely. And the WHO is active on the ground, too, working with countries, including in really difficult humanitarian settings, providing guidance, tools, and support to build better mental health responses.
This has been incredibly insightful. It really paints a picture of mental health as, well, deeply complex, influenced by so much around us and within us.
Definitely. And the message from the WHO is clear. We need a comprehensive approach. Promotion, prevention, and good quality, accessible, community-based care. All three are essential.
And there's a real sense of urgency from the WHO, too, isn't there? That action is needed now.
Yes, absolutely. The report highlights the need to accelerate efforts. We have strategies that work. We have a global plan. Now it's about making it happen for everyone.
So thinking about everything we've discussed, this complex web of individual factors, social influences, structural issues, here's something to maybe ponder. What single change, perhaps in your own environment or maybe in your wider community, do you think could make the biggest positive difference to mental well-being? Something to chew on. Thanks for joining us for this deep dive.